Hi everyone, my name is Megan Ivester. I am currently enrolled as a BS and a DMP student at Mercer University, Georgia Baptist College of Nursing. So today I'm going to be talking about vulnerable populations, and specifically for me, it's going to be pediatrics and chronic illness within pediatrics. So I currently work as a registered nurse at GI Care for Kids, and that's why I am extremely interested in this topic. I see a lot of adolescents not transitioning well, and the more I looked into it, the more I saw that we could do earlier interventions with this population prior to adolescent years. So that's where my interest in it came from. So I'm going to be speaking a little bit more about pediatrics and chronic illness today. So vulnerable populations include individuals who require additional protection when subjects of research. These individuals are likely to be vulnerable to coercion or undue influence when it involves making decisions regarding research participation. While many health disparities in the pediatric population mimic those experienced by adults, other health discrepancies are unique to pediatric health. These unique problems and their consequences on the pediatric population call for creative solutions, especially considering children may not be able to report symptoms reliably and cannot legally consent to care. According to the American Academy of Pediatrics, children with chronic illness have 20 to 35% increased risk of being classified as developmentally vulnerable on all domains compared with children without chronic illness. Up to 20% of children in the United States have a chronic or disabling condition, and because of ongoing improvements in healthcare, these children are living longer. With longer life expectancy, it is increasingly important to focus on children's adaptation to illness and to help them cope and optimize their psychological well-being. Nursing research must recognize healthcare research of children with chronic illness involves a multitude of ethical implications related to the vulnerability status of this population. Child rights can be viewed as more complex than adult rights related to the status of a child within society and how the child is seen as a rights holder. The purpose of this discussion is to highlight the vulnerability impact of chronic illness on children while addressing factors that may be associated with research ethics and the impact of ethical perspective on the delivery of ethical health care as well. So first is research ethics. Researchers have continued to recognize the need to balance the inherent vulnerability of children and adolescents with the necessity to research their unique needs and perspectives. Nurses are faced with ethical dilemmas on a daily basis as they care for chronically ill patients and their families. These ethical issues can be especially difficult when research participation of these patients is being considered and when these patients are actively participating in research studies. Parents or legal guardians ultimately have the authority and obligation to make decisions that are best for their children. Healthcare professionals must keep in mind that decisions to participate in research must be value-centered and determined on an individual patient basis, considering the patient's and the family's personal, cultural, and religious values. The following discussion includes information that centers on the ethical issues of conducting research with children. To approach informed consent, the researcher will predict the general age of children for target population and ensure that they are developmentally able to understand the purpose of the proposed study and their role as a participant. Consulting with children can be difficult related to avoiding stereotypes of child ages and family dynamic. Therefore, it's very important the researcher attempts to individualize informed consent to accommodate developmentally appropriate delivery for children. Autonomy can be defined as the right of self-determination and implies individuals, including children, that have the right to information regarding their care, especially involving research. Considering parents are to act autonomously on behalf of their children, the researcher needs to ensure the parents are adequately informed about the research study and allowing them the time and effort necessary to make a treatment decision. Having parental consent or permission for participation and child assent or affirmative agreement to participate meets the principle of autonomy. Although parental consent for participation remains the first step in involving children and adolescents in most research studies, researchers and human research ethics committees are now taking assent to participate in children aged 7 to 12 years and consent from adolescents aged 13 to 18 years, far more seriously. So obtaining children and adolescent assent to participate in research is valid and very important. as even young children have demonstrated the ability to understand the essential elements of research. Throughout the research study, the researcher would reaffirm that each child wishes to continue to participate in the study. Additionally, the researcher needs to ensure each child is fully informed of the process, along with self-determination, privacy, dignity, fair treatment, anonymity, confidentiality, and protection from harm upheld. Beneficence is another ethical principle and is defined as the act of doing good. Risk of research, in addition to benefits, should always be discussed transparently with the patient or child and family. In order for the nurse to act beneficently, the information about the study and its purpose, associated benefits, and potential risks should be reviewed with the parents and their child, while remaining aware of his or her obligation to respect the parent's decisions and refuse to participate in the study on behalf of the child or the child's refusal to provide assent. Researchers must respect patients and their families for their right to make informed healthcare decisions, especially when dealing with research studies. An ongoing needs assessment of the family should continue, particularly when questions about the study arise in the data collection phase. Special efforts should be directed towards minimizing any potential discomfort associated with the research study to assure the child's well-being. For example, if a child and/or family is already anxious with the given circumstance, information concerning invasive procedures or blood draws should be given in a factual manner. An injustice occurs when some benefit to which a person is entitled is denied without good reason or when some burden is imposed unduly. The needs of individuals who are considered vulnerable populations for research, such as children, should be addressed in order for them to benefit and equal treatment should be assured. For example, all pediatric patients who meet the inclusion criteria for a study should be invited to participate regardless of their ability to pay. This type of behavior supports the ethical principle of justice. The Child Research Advisory Group, or the CRAG, is an example concept that seems to integrate these ethical and moral ideals into research to gain insight with children from strictly a child perspective without family or parental influence. This is not common to see a focus group of 6 to 8 participants who are not old enough to consent themselves. However, the theory for capturing intentional participation in research and policy making is beneficial for the advancement of this population's health outcomes. This CRAG assists in speaking the language of children with insightful creative analysis through translation of complex language or drawings. Considering this study is specifically involving children in research, there are many ethical considerations present that combat any suggestion of negatively targeting this vulnerable population. The researcher specifically mentions accommodating the environment to help children feel welcome and to reduce their anxiety about participating. There are also ethical considerations present within the shared decision-making processes for pediatric patients and families. A case study concerning a female adolescent with cystic fibrosis, or CF for short, exemplifies this decision-making process for participating in a research study involving a double lung transplant. A young female patient was diagnosed with CF at age 12. Her disease took a toll on her quality of life, relating to missing out on school and lifestyle activities, as well as suffering detrimental health effects from her treatment at a young age. When the double lung transplant was initially introduced, she was very resistant to the idea. However, 2 years later, her resistance turned into hope, and she decided to follow through with the procedure. The glimpse of possibly restoring meaningful quality of life may shadow the realistic concept of the transplantation process. The ethical concerns present include informed consent and risk-benefit. Regarding informed consent, the patient and family were completely and realistically informed of the transplantation process prior to their shared decision. Also, international guidelines for selection of lung transplantation candidates have been developed for institutions to follow to guide appropriate recruitment. The recruitment criteria included end stages of CF. Therefore, it is important to keep in mind that this can be a very vulnerable time for members of this vulnerable population. So on top of the vulnerable population, this can be also a vulnerable time for them as well. That's something to keep in mind. Extraordinary gains for patients are wonderful. However, risk must be assessed realistically and discussed with the patient and family. In this patient scenario, the ability to breathe outweighed the complications of lifelong immunosuppression. Further development of guidelines to assist patients and families with informed decision-making will assist in alleviating some of these ethical concerns. So now to switch gears over to ethics and healthcare. So that was research ethics. Now we're going over to ethics and healthcare and that care delivery. So direct involvement of children in health-related research is essential to maintaining and improving standards of pediatric care. Potential intervention for overcoming ethical dilemmas from a patient-provider partnership standpoint is therapeutic patient education programs. This type of education relies on the understanding mutually agreed upon between patient, family, and healthcare provider on what the patient is responsible for and expected to do with the assistance of the healthcare team in order to manage disease with treatment. Specifically for children, these types of interventional programs should be introduced early and often to initiate sustainable change. However, there are most certainly ethical concerns with this type of approach also. First, education is targeted at a clear defined population where children with chronic diseases also happen to be a vulnerable population. Also, the goal of this interventional education is to encourage change or implement medical ideals, which could mean technically a change in identity. For both of these ethical concerns, it is necessary to focus on the individual patient and family, involve the multidisciplinary team, and encourage the positive impact of therapeutic education and treatment intervention. This type of approach, delivered within the triangular relationship of patient, parent, and provider, will empower the child and enable him or her to take an active role in self-management of disease. Implementing this type of plan early and often with children develops competencies and seems to be an essential part of successfully managing long-term disease. More specifically, within the pediatric chronic disease populations are adolescents on the bridge between stages of care. Technically, this adolescent age range still falls within pediatric classified care. However, the transition to adult care is inevitable, and conversations to illuminate this change are not always successful in bridging this transition. This population is extremely vulnerable related to multiple reasons. Not many adult providers are always trained to accept the variety of conditions seen in pediatrics, and the providers who are equipped to provide care are becoming overwhelmed with the growing number of childhood onset disorders as they are living longer. Also, adolescent patients are ill-prepared to take on the responsibilities required for managing their own care related to the lack of pediatric functional processes for teaching patients how to develop these skills. Transitioning adolescents from pediatric to adult care is more than a single event. It's a combined product of dedicated work by invested individuals. With all these changes involved with transition, this must be a collaborative approach to be successful. It is inappropriate and unfair to expect adolescents to handle new issues alone, such as changes to insurance coverage, informed consent, transportation, and other adult responsibilities. From the autonomy perspective, the care team has assisted in supporting the development of promotion of the patient's best interest. Patients strive to gain knowledge and confidence to serve them in their adulthood journey. The parent and the provider must foster a trusting relationship with the patient and accept the choices that he or she is making. Accessing and using appropriate resources such as outpatient clinic versus emergency room is a characteristic of justice. Without adequate support into adulthood, some patients might lose the ability to support themselves, leading to a downward spiral of chronic disease becoming a danger to themselves and society. In the sense of non-maleficence, patients gradually gain consciousness of the risk associated with their chronic conditions as it applies to their overall safety and self-care. As long as there are dedicated individuals who care about making significant changes, there will always be hope. In conclusion, clinical investigators involved in research with children must be conscious of ethical policies and IRB requirements relevant to this vulnerable population. The discussed population obviously exhibits a great deal of vulnerability from the age perspective being children and the health perspective being diagnosed with chronic illness. Ethical considerations were addressed and included factors that may be associated with research ethics and the impact of ethical perspective on the delivery of ethical health care. My hope is that vulnerability of adolescents diagnosed with chronic disease will be more recognized and more transition of care conversations will occur. Narrowing focus on adolescents in this transitional stage adds perspective to pediatric care as a whole, considering conversations should occur early and often. Like I said, early and often, that's my favorite phrase these days. So it is vital to consider the ethical and moral obligation in research and healthcare, especially with children. What initially categorized children as a vulnerable population is traditional research viewing children as objects rather than subjects. Ethical and moral obligation is so important to consider regarding the contemporary shift in pediatric research to participatory research for children. Additionally, ethical considerations have sharpened the edges of defining adult versus child rather than quote-unquote little adult, and fine-tuned accuracy for engaging with this younger population. Qualitative studies seem to be the appropriate approach for collecting data and enhancing a higher level of understanding of this population. Transparency of analysis and results is key in involving children and their family, enhances the research process. Thank you for listening.